We appreciate that. Under Committee Rule 9, we'll now question witnesses under the 5-minute rule, and I will begin the process. Dr. Goldfarb, 1 year ago, an article caught my attention that showed that new dimensions of critical race theory and DI had not yet been seen. Columbia University received an instant backlash when a video surfaced from 2021 showing medical students reciting an altered version of the Hippocratic Oath during a white coat ceremony. In the video, students chanted, "We also recognize the acts and the systems of oppression effected in the name of medicine. We take this oath of service to begin building a future guarded in truth, restoration, equity, and to fill the medicine's capacity to liberate." Dr. Goldfarb, this Hippocratic Oath is a foundational statement for every student. Am I correct on that, as they take this, as they begin this journey?
Yes, that's correct.
Is there anything about the standard oath that has mentioned systems of oppressed in medicine before now?
No, sir.
It is an important part of the education is to learn about medicine to liberate?
No, sir.
I think this is interesting, and just a little bit quick background. I majored in biology and chemistry. My last course that I ever took, the hardest in my life, was something called organic chemistry. I did a pass-fail because I wanted to not get a grade on that one. But in the end of the day, what I realized was those who truly mastered it were able to predict certain things. There's a math that's very predictable. There's a science based on God's laws that's very predictable. This is hypothetical, but as a physician, do you think that at some point, if patients are seriously injured or dies due to this practice of DI liberation sciences instead of clinical science, that there will be a possibility of malpractice lawsuits, not only for the physician or the med schools that train them?
Yes, so that is quite hypothetical, and I'm certainly beyond my ken. I do think that it's really important that it be viewed as a profoundly academic activity, medical school, and that the treatment of patients is really an academic activity. That, as you say, physicians must keep a lot of information in their heads, sort through it, understand human variability, and be able to apply it to that individual patient with that individual patient's problems. And that is a very academic kind of activity, and that's why I feel so strongly that it's academic achievement that ought to be the basis for acceptance into medical school and for the ability physicians to, for applicants to become physicians. It really is a profoundly intellectual process that really needs to be done in the best way possible for the patient's well-being.
I think we can all agree that this is one profession that meritocracy should be the primary focus. And I will say this, advice to any personal injury lawyers that are listening in, please pay attention to words like DEI and medicine if they're ever in the same sentence, same paragraph, or the same book when it comes to medicine. I think you might have a good profession moving if that's the case. Dr. Green, first of all, I appreciate your comments about the oppressor and oppressed. Help me understand, just can you repeat real quickly the impact it's having on the Jewish community that we're now beginning to see across the country when you have this idea or this indoctrination that there is a race that is truly oppressor of everybody else?
Well, thank you for the question. Once we deviate from the principle that we're going to treat everyone equally as individuals and start treating people differently based on their group identification, it's then a question of which group do the Jews get placed in? Are they placed in the group of oppressors or oppressed? And the determination of which group people are placed in is largely based on their over or underrepresentation. So any group that's considered overrepresented is considered an oppressor. Any group considered underrepresented is considered oppressed. Jews, because they have thrived despite oppression, are overrepresented in many of these instances and therefore are treated roughly as oppressors. And it's an intellectual justification of their rough treatment in academic environments.
Okay, thanks. And Dr. Smith, real quickly, I read something you said here. DI is harmful to the very people it claims to help. It stifles agency, and it is decidedly anti-black. As a black academic, I've been called a white supremacist by whites and blacks alike. By the way, welcome to the crowd. I've been called a KKK member by the Salt Lake Trib in Utah, believe it or not, for trying to empower black students. Can you expound on that a little bit? The last few seconds that we have.
Yes, I can. And that speaks to prescriptive racism, something I talked about during my original testimony. Prescriptive racism basically says that there is a list of characteristics that you have to abide by if you are going to be an authentic member of a group. Let's say Black Americans. If you don't abide by that script, then you are called inauthentically Black. I had the misfortune of hearing a keynote address at a conference a few years ago that really started this journey. The speaker had the argument that it was inherently racist.
We have to kind of wrap it up because we have just that's the last few seconds. If you can tie it down.
Oh, okay. It is not inherently racist to teach standardized English.
Thank you. Thank you so much.